Welcome to our lesson on valves and aneurysms. You can find this on pages 102 and 103 in your Nurse Workbook 2.0, or you can go ahead and print the page below this video so you can always come back to it and fill it out again or follow along with me. The purpose of this video is intended to give you more education beyond the Nurse Workbook 2.0, but provide you with real world nursing education as well. And the valves of our heart are actually more of an unsung hero than we give them credit for. They play such an important role by managing the direction of our blood flow. But just like everything in our body, they can definitely have structural issues, get prone to infections, and all kinds of things can go wrong. So we're going to jump in and look at the valves of our heart. What exactly is a valve? And this is going to be a flap that maintains that forward flow of blood and closure to prevent any backflow. So we're going to label these 4 valves right here. We have our tricuspid valve. So this is going to be between our right atrium and our right ventricle. And then we have our pulmonary valve or pulmonic valve. And this is going to be the valve that the blood leaves the heart and goes into the lungs. Then we have our mitral valve, and this is going to be between that left atrium and the left ventricle. We also have our aortic valve, and this is that valve before the blood leaves the heart and enters the aorta. And as a little tip, a lot of people get hung up on which side the tricuspid and mitral valve is on. Well, because mitral ends with the letter L, I always remember that mitral is on that left side. And a patient can require valve replacement for several reasons. It can be from congenital, that would be issues from birth, or it could be from something like an infection. And this would be something like endocarditis, which we're going to go into in a future lesson. We can also get it from aging just because of so much use over time, or even something like rheumatic fever. In patients that have valve issues, we're going to see them have breathlessness, shortness of breath, feeling pretty tired. They might be swelling, maybe swelling their legs or their overall body. And we can also see irregular heartbeats as well. So when a valve is defected or it potentially needs some kind of replacement, we can do this in 2 different ways. We could do this by doing a tissue valve replacement, and these tissue valves could be taken from pork or cow or human cadavers. But the best part about tissue valve replacement is we don't need to put patients on any coagulations or blood thinners post-procedure. The only downfall about these really is that they're going to have a shorter lifespan than our artificial valves. And our artificial valves can be made of metal or carbon or alloy based. And we know these valves are going to last longer, but they're contraindicated for people in high-risk activities. They do require anticoagulation therapy or blood thinners. But before we move on from valves, there are 2 medical terminology words you might hear in your daily practice that deal with valves. So the first word is our stenosis, and this means that a valve isn't fully opening and it's stopping the forward flow. We look at our anatomy over here, and if this valve isn't able to fully open, we can see that this blood is going to have a really hard time getting out because we don't have that standard wide opening for it to leave. And then we also have regurgitation. Regurgitation is when the valve doesn't fully close, and so that allows for our backflow of blood. So let's test our knowledge before we move into aneurysms. So true or false? Valve surgeries are required during a cabbage. This is false. We do not necessarily need to replace a valve during a cabbage, although that could happen. It isn't mandatory. And true or false, artificial valves do not require blood thinners. And if we remember from what we just talked about, this is going to be false. Our artificial valves do require blood thinners, which is why it is dangerous for people in high-risk activities to be on blood thinners. So now we're going to move into one of the scarier parts of our practice, aneurysms. And an aneurysm itself means an enlarged abnormal bulge of the vessel wall. There's actually two places that we can get aneurysms. Typically, we can get them anywhere in the body, but typically we could get them in our abdominal aorta, or we could get them in our brain, and that's known as a cerebral aneurysm. And aneurysms are only found in arteries. So before we talk about all the types of aortic aneurysms, we're going to do a quick overview of our anatomy. The aorta is the largest vessel in the human body, and it is an artery. So it's carrying blood away from the heart. The aorta is going to branch off the heart, as you can see here, from that left ventricle at this aortic root. We actually divide the aorta into subsections so we can label specific parts of the aorta. We have our ascending aorta, the aortic arch that we see right here with these big three branches that we anatomically normally see. And these big three branches are responsible for supplying blood to the upper part of our body. We have our descending aorta after the aortic arch. And from here, this divides into our thoracic and our abdominal aorta. This ascending part of this aorta here gives blood to the coronary arteries, which supply the heart muscle themselves. So if we go back to our activity, what is an aortic aneurysm, this AA? So this is going to be an enlargement of the aorta due to weakened walls that have a dilation of 1.5 times the diameter. So if we look at the internal layers of the aorta, it's going to be composed of three walls or layers. This most inner layer is going to be known as our intima. This is the layer where that blood is flowing next to. The middle layer is made up of smooth muscle called the media, and the outer layer is known as the adventitia. These three walls make this one big structure, and it allows it to withstand high pressure. So blood that pumps directly from the heart maintains a steady flow of blood throughout the body. However, if we have weakness in any layer of this wall, then we could develop this thing we call an aneurysm. So we'll start with our blood vessel right here, and you can see it has that beautiful spongy inner layer with that smooth muscle inside and the outer layer. Everything looks pretty good here. And then we look at our high blood pressure, and you could see that there's a lot more pressure being put on the layers of this wall. So we could have our genetics, our smoking, high cholesterol, all of those things can contribute to weakening this vessel wall. So if we look at this little pouch right here, we could see that there's a little tear in the wall, and there's this little pocket of aneurysm that can form when this area is torn. And we can compare this down here as well. So we see this vessel wall and our blood is flowing up it. But as you can tell, there's a little tear here in this wall, and that blood is going to accumulate in that pocket. And this is where it gets dangerous. If this tear increases in size and eventually gets too tight or to an area that's too weak, then we can have a ruptured aorta. And this could be extremely life-threatening. The risk of rupturing typically depends on the size and the growth of the aneurysm, and typically these develop over long term. So we're going to move into the terminologies of aneurysms. And there are three types that we see specifically in aortic aneurysms. So when an aneurysm presents with a widened pulse pressure, a bounding pulse, and a diastolic murmur, we're going to see this in our ascending thoracic aneurysms. This is also known as a TAA. If we see aortic aneurysm, and the most common finding is that pulsation in the abdomen, this is what we call a AAA, or an abdominal aortic aneurysm. And an aneurysm that has intermittent or constant chest pain that radiates into the back with some dull pain that people complain about between their shoulder blades, this is known as a descending thoracic aneurysm, or a DAA. To get a good look here at our anatomy, we have our aneurysm that's going to be present here in this little wall. As you can see, there's a little tear. This is going to be before that rupture, and this is where that blood is flowing. And how do we treat these abdominal aortic aneurysms or aortic aneurysms in general? Well, there's not a lot that we could do until the patient goes to surgery. So it's really important that we lower that pressure. So if you think about the pressure that's actually tearing those walls, we want to not only lower the pressure, but lower the heart rate as well. So we're going to do BP control, so hypotensive medications. We also want to lower the heart rate if it is above 100 beats per minute. Oftentimes, these are going to be super painful for our patients, so we're going to want to make sure we give them adequate pain control as well. And if you think about it, if they're in pain, they're going to be straining and not breathing so efficiently, and they're going to be hurting. So make sure we also are addressing that too. This concludes our valves and aneurysm lesson, and I will see you in the next one.